Good day, everybody. Welcome to the Dr. Harris channel. Nice to have you back. Today's video is going to be one that is a consult for diabetes. We're going to be looking at Brussels sprouts, cinnamon, chlorophyll, and bitter melon in the way that they are assistance to the cells and to the insulin signaling pathway to help with the proper maintenance for glucose regulation in people's body. So we are only going to look at and talk about 4. There's lots of others. These 4 I believe are going to be the best for what we're doing because it's easily received, easily picked up, and easily used. By way of, you can pick up Brussels sprouts from anywhere, bitter melon can be picked up from anywhere, chlorophyll can be picked up from anywhere, cinnamon can be picked up from anywhere and used very easily. No one needs to take any advanced courses or look at any do-it-yourself videos in order to practice use of this type of any of the things that we're going to mention to assist the cells with the uptake of sugar in one's blood if that is what's necessary. And then also, as a practitioner, it's easy to talk about this to a patient, a client, if they have the knowledge of what these things are, rather than some of the other ones that are not as easy to get and may not be known. Not that not knowing it is a problem, just if it's familiar, there's a better chance for compliance. If it's easy to use, there's a greater chance for compliance. And then, of course, the results, then there would be a better chance for compliance. And seamless understanding is key. So it's introducing something new is nice. Introducing things that are reintroducing something that's old and explaining how it can work, what the bioactive component within that substance is, and how that bioactive component works on a cellular level to help support this will be a benefit for all that watch it. So again, if you have not already subscribed to the Dr. Harris channel, do so. Share us with others, your loved ones, your fellow co-workers, clients, your family, the norm. So that's that. Enjoy the video. If you have any questions, please take the time to use that area, the comment area on the YouTube channel. Put your question in there and I will respond to it. Or you can email me at dr.claudiaharris@gmail.com. I will put the email at the end of the video if you don't already have it. It's not necessary. Like I said, you could just use the comment box and I will see it and answer the question. That's what we can do also. So again, take your time, watch the video. Any questions, comments, give them to me and I will see to it that I get back to you as soon as I see them. All right then, be well, enjoy the video.
Diabetes mellitus is a disease in which there are high blood sugar levels over a prolonged period. Diabetes can be due to either the pancreas not producing enough insulin, or the cells of the body not responding properly to the insulin produced. There are 2 main types of diabetes mellitus. Type 1 diabetes mellitus results from the pancreas's failure to produce enough insulin. Type 2 diabetes mellitus begins with insulin resistance. Insulin resistance is due to the insulin receptor not responding to insulin sent from the beta cells of the pancreas. As a result, cellular uptake of glucose does not occur, and blood glucose level is elevated. Finally, this leads to type 2 diabetes mellitus. Insulin resistance is caused by excessive nutrition. As an example, habitually ingesting too much food, such as having a half plate of rice at 2 of the 3 big meals in a day, on a regular basis. Inflammation and oxidative stress. It means the imbalance between the production of free radicals and the ability of the body to detoxify their harmful effects through neutralization by antioxidants. Excess nutrients promotes the insulin resistance by activating the mTOR pathway, mammalian target of rapamycin pathway. mTOR causes dephosphorylation of IRS1 at tyrosine place and phosphorylation at serine place. When IRS1 is phosphorylated at the serine place, the activation of PI3K and ACT proteins do not occur. Further, mTOR can directly inhibit the ACT protein, which is activated by excessive nutrition. So, this inhibits the membrane translocation of GLUT4 protein to transport glucose from outside of the cell to the inside. Various inflammatory mechanisms induce inflammation, insulin resistance, and decrease insulin secretion from pancreatic islets. Pro-inflammatory cytokines, like TNF-alpha, interleukin-1, and interleukin-6, involved in inflammatory mechanisms. They may alter the normal structure of beta cells by inducing pancreatic islets apoptosis. Glucose, which is transported in the bloodstream, are taken up by the cells in the islet, called beta cells. Beta cells respond by producing the hormone called insulin, which lowers the blood glucose level. In type 2 diabetes, lots of insulin is produced by the beta cells to lower the blood glucose level. Unfortunately, sustained production of insulin leads to secretion of hormone-like substance by the beta cells. White blood cells respond to this hormone and consume it. Inside the white blood cells, this hormone creates inflammatory proteins with the combination of glucose. This inflammatory protein is then secreted into the beta cells. After that, it causes the death of beta cells, which results in shrunken islets that cannot produce sufficient insulin. This will allow for increased blood glucose levels. Further, these inflammatory mediators activate JNK, Jun nuclear kinase, and IKK inhibitor, kappa B kinase. IKK and JNK inhibit phosphorylation of IRS1 through the transcriptional activation of inflammatory genes, such as INOS, and the promotion of insulin resistance. Oxidative stress is increased due to an increased production of oxygen-free radicals and inefficient performance of the antioxidant defense system. This free radical causes nitration of IRS1, PI3K, and AKT to provide inhibitory action on them. Activation of PI3K and AKT is absolutely necessary for GLUT4 translocation to the cell surface. This is a healthy tissue cell entering a tissue cell through the cell membrane. There are many elements in our body that comprise molecules. A free radical is an atom, or group of atoms, that has an unpaired electron, and is therefore unstable and highly reactive. These free radicals can capture electrons from normal healthy molecules, and create free radicals that damage the healthy molecules, such as molecules found in DNA. The damaged cell can release free radicals, and continue the effects of oxidative stress to surrounding cells. Plant-based medicine plays an important role as alternative medicine to treat diabetes. Hypoglycemic herbs increase pancreatic beta cells regenerating, increase insulin secretion, enhance glucose uptake by adipose or muscle tissues, and fighting the problem of insulin resistance. This review will concentrate mainly on anti-diabetic properties of Brussels sprouts, bitter melon, chlorophyll, and cinnamon. Brussels sprouts is a cruciferous vegetable. They have anti-inflammatory properties, which is why they are potent in preventing the development of diabetes type 2. Brussels sprouts contain a compound named isothiocyanate sulforaphane, which is a powerful anti-inflammatory compound. Sulforaphane suppresses secretion of pro-inflammatory cytokines such as interleukin-2, interleukin-4, interleukin-6, and interferon gamma. It also suppresses homeostatic proliferation of T cells, and lipopolysaccharide-induced pro-inflammatory mediators in macrophages. Brussels sprout is a super-rich source of vitamin K and omega-3 fatty acids. Both are highly effective in reducing internal inflammation. Brussels sprouts also contain alpha-lipoic acid. The antioxidant, alpha-lipoic acid, supplies the free radical with an electron to repair and stabilize the chemical bond. It lowers blood glucose level, increases insulin sensitivity, increases glucose uptake and prevents oxidative stress-induced changes in patients with diabetes. These compounds can increase insulin sensitivity and prevent prediabetes from turning into diabetes. Bitter melon. Bitter melon causes a significant decline in non-fasting blood glucose, plasma glucose intolerance, and insulin resistance. Ethyl acetate is a component in bitter melon. It activates peroxisome proliferator receptor, alpha, and gamma. Peroxisome proliferator receptor modulate the phosphorylation of IRS1 and stimulates the insulin signaling pathway. Bitter melon regulates the insulin signaling pathway in pancreatic beta cells, adipocytes, and muscles. Mamordicoside. The mamordicoside component in bitter melon stimulates GLUT4 translocation to the cell membrane. Chlorophyll. Chlorophyll from fresh green leaves has potent anti-inflammatory activity. Chlorophyll inhibits the pro-inflammatory cytokine called bacterial lipopolysaccharide-induced TNF-alpha, which induces the inflammation. The anti-diabetic components in chlorophylls include vitamins A, C, and E. They give antioxidant and anti-inflammatory properties to the chlorophyll. The antioxidant potential of chlorophyll helps the body to fight against the various pathogens attacking the body. It will also prevent the initiation of free radicals, and thereby eliminates the factors responsible for oxidative stress. Cinnamon. Cinnamon has been associated with various health benefits such as antimicrobial, antiviral, antioxidant and insulin-like activities. Cinnamon increases the activity of phosphorylation of beta-insulin receptor, while reducing tyrosine phosphatase activity. In this way it shows insulin-like properties. An anti-diabetic component in cinnamon, methyl hydroxychalcone polymer, activates the fat cells to insulin, by activating the enzyme kinase of the insulin receptor, and inhibiting the action of insulin phosphatase receptor. That blocks the action of insulin, as a result increases insulin sensitivity. Also it triggers the insulin cascade, increases both oxidation of glucose and insulin secretion, and this prevents increasing cellular resistance to insulin. As well as, it stimulates glucose uptake and glycogen biosynthesis, through the activation of glycogen synthase and inhibition of glycogen synthase kinase action. Furthermore, cinnamon improves the insulin sensitivity by activating AMPK, adenosine monophosphate activated protein kinase, which inhibits the activation of the mTOR. When mTOR is inhibited by AMPK, there is no inhibition of ACT1 by mTOR. So ACT1 can activate the translocation of GLUT4 towards the cell membrane. In addition to benefiting type 2 diabetics, cinnamon may also benefit individuals with impaired glucose tolerance.
Okay, so I hope it was clear. Thank you for joining the Dr. Harris channel. And again, if you have any comments or questions, please feel free, actually, definitely comment and ask your questions so that I can answer them for you. If you have any questions about suggested or recommended dosages for the Brussels sprouts or for the cinnamon or for the chlorophyll or for the bitter melon, again, hit the comment box. But off the top of my head, for the general consult, in regards to the bitter melon, if you're not already used to bitter melon, it's a good tool for you to use. And then you would take 3 thinly sliced pieces of the bitter melon, cook it, and we'll saute it a little with some garlic to cut a little bit of the bitterness, and then you ingest that. Also, make sure if you're going to do that, you have to check your blood sugar levels. You don't want to take in all 3 just straight. You might not need it. It's very bitter. It's very potent if you're not accustomed to using it already. In regards to the Brussels sprouts, depending on how you'd like to use the Brussels sprouts, if you're going to use them in a juice, you can use 6 to start you, but 9 to 12 Brussels sprouts in the juicer. If you're going to cook them, or you only a little bit of cooking, you don't overcook them, you slice them so that they're easier to cook, and you saute them in the pan. You could use 6 of those, and that could be fine. If you're going to use cinnamon, then you're going to use a teaspoon of the cinnamon. You could throw that in whatever, cereal, yogurt, if it's plain yogurt, however you can best get it in. That's all you're going to need is 1 teaspoon of the cinnamon. In regards to the chlorophyll, if you're juicing already, you can just use kale or spinach, whatever green, because chlorophyll is the green pigment found in these plants, so it's going to give it to you. If you'd like to take a pill, you'll have to ask, and I will then give you the dosage, because it'll be different for different people. If they already take chlorophyll, then for the same thing I said about bitter melon, then you use something else, because your body would have already been acclimated, and then it will act differently. Okay? All right. All the best. Stay well.